My Health Matters is a flagship initiative of Global Health and Community Services, Inc. This monthly one-hour forum aims to educate and inspire communities across the globe. My Health Matters provides culturally relevant health information, resources, and tools to get the best quality health care, access to some of the top health experts. Each episode will highlight the healthcare issues that disproportionately affect many communities, while also providing action steps to help us heal. My Health Matters.
Good afternoon. I am Kitty London, your host of My Health Matters television program. Today's program is being recorded. This television program is brought to you by Global Health and Community Service Incorporated and the Florida statewide organization of Omega Psi Phi Fraternity Incorporated. Our platinum sponsor is the Quantum Foundation of West Palm Beach. We would also like to recognize our other sponsors, the TED Center, Healthier Boynton Beach, Truist, Nonprofits First, Epsilon Gamma Omega, chapter of Alpha Kappa Alpha Sorority Inc. of Huntsville, Alabama, and Alpha Alpha Upsilon Omega, chapter of Alpha Kappa Alpha Sorority Incorporated of Wellington, Florida. We would like to extend a special thank you to our production team, C. Ron Allen and Nelonsky Noel of KOP Mentoring Group. That's it, and enjoy the show. Good afternoon, everyone. I'm your host, Kitty London, for My Health Matters TV. I'm so excited about the show today because we are discussing heart disease and hypertension. Let's face it, with everything that's going on in the world, it is hard to not get the numbers to spike up, but we want to make sure that we keep you healthy, and we want to know the things to do to prevent heart disease and hypertension, if all possible. If you have any questions, please put it in the chat, and we can try to get to those questions if we can by the end of the program. We have a team of experts that are going to help us today with everything that we need to know about hypertension and heart disease. But before we get to our wonderful show today, we would like to have greetings by Rosemary Cunningham.
My father experienced a triple bypass surgery in his early 60s. My family was devastated. I am thrilled that our panelists have chosen to give of their time to express their expertise on heart disease and hypertension, because guess what? Your lives matter.
Thank you, Ms. Cunningham. We have another set of greetings from State Representative Darren Toston. Welcome, Darren.
Good afternoon. And on behalf of our 7th District's Florida statewide organization of Omega Psi Phi Fraternity Incorporated, I want to thank you for joining us today for our webinar on heart disease and hypertension. Thank you to our Medical and Health Initiatives Committee, our partners, Global Health and Community Services, our sponsors, and our speakers for today's discussion. Also, I would like to give a special thanks to the immediate past State Representative of Georgia, Brother Marvin Broadwater, for joining us today and sharing his experiences with us. Again, we want to thank you for joining us, and we hope that this webinar is informative and insightful. Thank you.
Thank you, State Representative. So we are very excited, and let's get into our team of experts today. First, we have Dr. Jinga Brim, who's an adult nurse practitioner, and her passion is for people and how we can stay healthy. So I want to thank you for joining us, Dr. Brim.
Thank you
All
for
right.
having me.
Thank you. So we're going to move on to our next great panelist is Dr. Rachel Bond. She's a certified attending cardiologist in Arizona who has devoted her career to treatment of heart disease. Welcome, Dr. Bond, to the show.
Thank you for having me.
Thank you. Next, we're going to move on to Marvin Broadwater. He was the 17th Georgia State Representative of Omega Psi Phi fraternity, and he is also a heart attack survivor. And he's going to give us some tips on what we can look out for if we have a heart attack or anyone that we know that may have symptoms that we need to have warning signs for. Our next guest is Dr. Elizabeth O'Feely. She's a professor of medicine at Morehouse School of Medicine and practicing cardiologist with Morehouse Healthcare in Atlanta, Georgia. ATL is in the house. Welcome, Dr. O'Feely.
Thank you so much for having me, Kitty.
You know it's Atlanta when you have the chandelier in the back, right? And the red glasses. She's a fashionista and she's smart. I love it. Thank you, Dr. O'Feely, for joining the show.
Thank you. Glad to be here.
Thank you. And last but not least, we have Dr. Sneed, who is a pharmacist. I love my pharmacist because I love to take medication. I don't like pain, so give me the meds. But he's a 10-year professor at the founding dean of University of South Florida, Tanaja College of Pharmacy. Thank you very much for joining us, Dr. Sneed.
Very happy to be here with all of you and the panelists today.
All right. Well, I can't wait to get into the show, but we have to do things that pay the bills. So we have a commercial break coming up. But right after that, we are getting into the questions. So please stand by. You do not want to miss this show. Thank you.
Vital Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Hello, everyone. This is Kitty London, and I'm your host for My Health Matters TV, brought to you by Global Health and Community Services and the Florida statewide organization of Omega Psi Phi Fraternity Incorporated. We have an exciting lineup of shows with a variety of topics that will make you say, have you more educated on your health and hopefully convince you to make your next checkup. Please make sure you join us this Saturday at noon as we discuss nutrition and healthy eating. And then it does not just stop there. In August, we're going to talk about hypertension and heart disease. You know, that silent killer that we need to make sure our numbers are right. September, men, make sure you check in because we're going to discuss prostate cancer and treatment options. October, sickle cell disease and the sickle cell trait. I have it, so I want to make sure that you are more aware on the community and what's going on with sickle cell. In November, when we eat so much, we're going to talk about nutrition again, but also talk about diabetes and the treatment. In December, make sure all my couples check in because when you think the thrill is gone, it does not necessarily mean that. We are going to discuss ED, which is erectile dysfunction. Now, you want to know how can you join us? Well, I am glad you asked. I want you make sure you check in on Global Health Foundation on Facebook, and that's Global Health Foundation on Facebook, and also KOP mentoring network on YouTube. So we cannot wait to see you, and hopefully we can all learn together so we're more educated on health. See you then. Those shows actually have me excited. I'm like, oh, I cannot wait. But we are talking about today, we're going to stick on the topic of hypertension and heart disease. I am going to start with Dr. O'Feely. I have a couple of questions for you so we can kind of get our viewers educated and make sure at the end of the show that they make their next checkup. First of all, what is heart disease? And also, what are the signs and symptoms and treatment options of heart disease?
Sure. Thank you so much, Kitty. And again, I'm glad to be here. So when we talk about heart disease, we're actually referencing what we call heart and blood vessel disease. And in the doctor's office, we call it cardiovascular. Why do we say that? Because the heart and the blood vessels are so connected that when something is affecting the blood vessels, it winds up affecting the heart. So the number of heart conditions that I will mention, because all of them have similar risk factors, and we need to think about that when we're thinking about our risk for cardiovascular disease or heart and blood vessel disease. So for example, a lot of us know about somebody having a heart attack. We're going to hear from Mr. Broadwater shortly. Also, people having a stroke, people that present with what we call congestive heart failure. Some people have heart valve disease, either because they've had some rheumatic fever as a child or because they have some things happen that they were born with, what's called a heart murmur, that winds up putting stress on the heart. So there are all of these things that can affect the heart. But what we also have there is what we call risk factors for heart disease. That means something that you were either born with, runs in your family, or you're exposed to as a result of your own environment or some of your own personal habits. So again, there's a list of them, but I just want to mention some critical ones. You will hear about high blood pressure. It's a big problem, and it's a risk factor for cardiovascular disease or heart and blood vessel disease, including heart attacks and strokes. High blood cholesterol, a family history. So somebody in your family had a heart attack when they were under the age of 50 or 55. If somebody in your family has been on dialysis for kidney problems, somebody in your family had a stroke, you need to think about, does that affect your own risk? And the only way you can check it out is to get some of these things done, what we talked about in terms of blood pressure, cholesterol, blood sugar, which is the diabetes. So I'm going to pause there first and see if...
No, that's fine. It sounds like to me, people, we need to get our blood work. We need to know our levels. So, we have people sometimes that will sit on their couch and say after a good meal, right? And they'll start to feel something. And it's like, wait a minute, is this a heart attack or is this indigestion? Do you have just any tips to know the difference between I have some bad gas or I may need to call 911?
Excellent question, Kitty. So it turns out that we see on TV and some of the shows, somebody's having a massive problem. They're clutching their chest. They can't breathe. Those are all important signs of a heart attack. Many people actually don't have pain, as we would call it pain. A number of my patients would say, I just have this uneasiness in my chest, or I kind of feel exhausted. If you're feeling symptoms that are not specific, including what you mentioned, indigestion, I cannot tell you how many Black patients have wound up with a heart attack because they thought they were having indigestion. They took Tums, they drank water, they did everything else but call 911 or check in with their doctor. So it is important to recognize that the risk factors and the symptoms can be important, but also some symptoms may be more subtle. For example, if you know you have a family history of heart problems and your cholesterol is high or you're being treated for high blood pressure, and you come up with feeling like, I can't breathe when I'm trying to walk or exercise, or I wake up in the middle of the night and there's this uneasiness in my chest, that's not normal. Or sometimes I notice my legs are swollen or when I lie down, I can't breathe quite like I do when I sit up. Those are not normal. And some patients would say, well, I just think it's because I gained weight. No, it may be weight, but it also could be something going on with your heart. It's always better to be on the safe side and get it checked out. Some of my patients would come in and they're just feeling a sense of palpitations, feeling like their heart is beating fast. That's not normal. It could be a sign of your heart reacting to something going on inside your heart or your blood vessel. So that's very important to think about the symptoms as well.
Thank you so much, Dr. Phil. And I promise we will be back to you. All right, because I know it's more. So next up, we have Dr. Bond. Welcome, Dr. Bond, again. I have a question in regards to what is hypertension? And just like I asked Dr. Phil, if you can just elaborate too on the signs, the symptoms of hypertension. Also too, it comes to people, a lot of people right now are expecting. So we don't talk about that as well too. So please elaborate on that. And also, I know it's a loaded question, but also, what's the difference between stress hypertension and I really have hypertension?
Yeah, no, these are wonderful questions. And as Dr. O'Feely said, high blood pressure is a very common risk factor for heart disease, stroke, or what we like to umbrella under the term cardiovascular disease. So I think the best way to understand what high blood pressure is to actually understand what our blood pressure is doing and why our body needs a blood pressure. So what the blood pressure is the force of actually blood flowing through our blood vessels. And when that force is very high, that's by definition high blood pressure. We really want to strive to have a normal blood pressure, which when we think about the numbers is usually less than 120/80 millimeters of mercury. Anything above that is elevated up until we get to a number on the top of 130 and a number on the bottom of 80 millimeters of mercury. And you bring up a very valid point about the signs and symptoms. And as you mentioned in your introduction, high blood pressure is called a silent killer because many a times you don't feel any signs or symptoms. When you actually do begin to feel signs and symptoms, that's when it's too late. That's when you're in a severely elevated range, and the actual blood pressure may already be impacting your heart structurally, where the muscle is very weak, so you begin to feel shortness of breath. You may also experience pain or pressure in your chest because your blood pressure is so high. And of course, we know that there's a big correlation between patients that have high blood pressure and the risk of stroke. So any neurological signs or symptoms such as dizziness, lightheadedness, headaches, possibly even the inability to move their upper arms or lower legs. These are all very concerning signs that the blood pressure is severely, severely out of control. Now, how do we avoid getting to the symptoms? The most important way is to actually go to the doctor, make sure at a minimum you're annually getting your blood pressure checked. And I do want to bring up the maternal aspect of this, as you very nicely asked. I am a cardiologist, but I focus a lot of my work on women's cardiovascular health, specifically during pregnancy. And we know that, especially in the Black community, there's rising rates of death during pregnancy, and the leading cause is due to heart disease with high blood pressure during pregnancy from either conditions like preeclampsia, when your blood pressure is very high and you have evidence of other organs that are impacted being the culprit. What I do think is important for people to realize is that if you did have issues during your pregnancy, such as preeclampsia, or blood pressure issues with your pregnancy, that does place you at a higher risk of having a transition once you're outside of that pregnancy window to high blood pressure or heart disease. So it's extremely important that you establish with a primary care clinician and possibly a cardiologist to make sure that your numbers are well controlled.
Now, Dr. Brown, really quick, and I know you mentioned the numbers, which is so helpful because I'm like 120/80. Okay. Can you please let us know too, as far as checking the blood pressure? I know a lot of times people will have the wristbands, which I hear are not so accurate, and then you have the ones that are shoulder, the ones on the shoulder. What do you recommend as far as which one to use?
Yeah, so all of our cardiovascular societies actually do strongly recommend that you check your blood pressure at home. However, we want to make sure that we're using machines that are validated. There's several organizations that actually have a list of all of the brands that have been validated either by the FDA or other organizations. What I will say is that the rule of thumb is that typically the upper arm is the preferred location as opposed to the wrist in terms of accuracy. It's also important how you're checking your blood pressure, not just using the machine, but you want to make sure that your back is supported, your feet are flat on the ground, that you've emptied your bladder. Actually feeling the urge to go to the bathroom can drive your blood pressure up, as can stress. So you don't want to have a heated argument right before checking your blood pressure. You really want to rest for a good 5 to 10 minutes before checking it. And the same way, sometimes caffeine can drive up your blood pressure. You want to make sure that you haven't had any caffeinated beverages. And that's really the best opportunity for you to check it. I would also stress the importance that you don't want to check it probably the same time each and every day. You want to do it different times throughout the day. That way we can get a better average of what your true blood pressure actually is.
Thank you so much. And please listen to the expert. Don't listen to me. Don't check your shoulder because you'll get a wrong reading. Okay, we'll be back with Dr. Brim next. We have to pay bills and we have a commercial break. Thank you.
Vital Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Hello, everyone. This is Kitty London, and I'm your host for My Health Matters TV, brought to you by Global Health and Community Services and the Florida Statewide Organization of Omega Psi-Phi Fraternity Incorporated. We have an exciting lineup of shows with a variety of topics that will make you say, have you more educated on your health and hopefully convince you to make your next checkup. In August, we're going to talk about hypertension and heart disease. You know, that silent killer that we need to make sure our numbers are right. September, men, make sure you check in because we're going to discuss prostate cancer and treatment options. October, sickle cell disease and the sickle cell trait. I have it, so I want to make sure that you are more aware on the community and what's going on with sickle cell. In November, when we eat so much, we're going to talk about nutrition again, but also talk about diabetes and the treatment. In December, make sure all my couples check in because when you think the thrill is gone, it does not necessarily mean that. We are going to discuss ED, which is erectile dysfunction. Now, you want to know how can you join us? Well, I am glad you asked. I want you make sure you check in on Global Health Foundation on Facebook, and that's Global Health Foundation on Facebook, and also KOP Mentoring Network on YouTube. So we cannot wait to see you, and hopefully we can all learn together so we're more educated on health. See you then. All right, we are back. So we are up next. We have Dr. Brown. Welcome again, Dr. Brown.
Thank you. Thank you for having me.
Oh, great. I have a couple questions because you are an adult practitioner. So you see both men and women. Can you tell us a little bit of a difference between what you see in women's symptoms when it comes to either having a heart attack, heart disease, in men? Because I hear that there is a difference, but I want to make sure I'm correct.
Yes, ma'am. There is a difference between the symptoms that a woman can have versus a man. We're made different from men. And the plaque builds up differently in our arteries. And women who have high blood pressure or diabetes, that puts them at a higher risk of having cardiovascular issues in some cases in men. Symptoms that a woman can have, it may not be typical that they're having chest pain, but chest pain can occur. Pain in the lower chest or upper abdomen can be symptoms for women. Jaw pain, back pain as well. And a lot of women complain of nausea and vomiting or shortness of breath because the heart is working harder to get the body perfused with oxygen as it needs. Women complain of indigestion a lot when they're having cardiovascular symptoms, extreme fatigue, as Dr. Feely before, and lightheadedness. Now, typically with men, men are the ones that we'll hear say they feel like an elephant is sitting on their chest. They feel that pressure in their chest. They can have the jaw pain and the back pain as well, and nausea and vomiting. And of course, the heart is working so hard to do what it needs to do, so they will complain of shortness of breath as well. But the thing about women also is it's important to know these symptoms because we are our best advocates for ourselves. We should love ourselves. And that's why I always stress the importance of learning these signs and symptoms for yourself, because especially in women, oftentimes, unfortunately, they're turned away in the ER thinking that it's indigestion or it's a flu-like symptoms that are going on because our symptoms are more subtle. And it can be mistaken for something else. So it's important that not only women, but men do know their bodies well, have those discussions with their cardiologists so that they can be able to advocate for themselves.
Right. And I'm sure, because I'm listening to the symptoms that you said, and I promise you, I've had some of those symptoms, right? And I'm not claiming I have any cardiovascular issues. I'm not claiming it, but I'm sure some of our audience is like, oh my gosh, I felt lightheaded last week, or, I had indigestion, I'm stressed out, things are happening, my body's going crazy, I'm menopause, and whatever the case may be. So what advice quickly do you give people who are like sitting at home thinking, check, oh my gosh, I'm having a heart attack? What do you suggest?
To me, you can never overreact. It's always better to be safe than sorry. You can always call a telehealth and get a virtual visit in today's society really quickly. You can always I know some insurance companies have something called Dispatch Health, where you can call an urgent care team and they will come to your house and do an EKG, do an assessment, see what's going on. And if they determine that or see serious signs or symptoms, they'll get you to the emergency room. Some insurances on the back of their card will have a dial a nurse line where you can get a hold of a clinician who will be able to tell you if it's just indigestion or they'll help relieve your doubts and your fears. But when all else fails, it's best to either call 911 and have a trained professional assess you or go to the emergency room.
Okay. All right. Thank you, Dr. Brown. And up next, we have one of my favorite doctors because he makes us feel better. We have Dr. Sneed. Welcome again, Dr. Sneed.
I'm very happy to be with you, Kitty.
Thank you. So after you see all these wonderful doctors, right, usually we come to you with what we call a prescription. And then after that wonderful prescription is filled, we feel like, oh, the world is going to be a better place now because we're going to be healed. And then we read those side effects. And then we say, nope, we are not taking that. Our doctor is trying to kill us faster. So can you please give us a little more education too on how to properly take your medication, when to maybe not take the medication, and, just some other alternatives too, because, we don't want to pop pills for the rest of our lives if we don't have to.
Yeah, these are all very good questions. And I think the very first thing I often tell my patients is don't let the commercial with the 15 things that will kill you about this medication scare you. We are all trained professionals, whether it be your cardiologist, your family physician, family nurse practitioner, or your pharmacist. And so we have a pretty good idea of what the most common side effects are probably going to be, and we'll very likely warn you about that long before we have you take the medication, number one. And number two, the second thing I often tell people is don't expect that the medication alone is going to be the thing that will help, that will solve everything for you. Pills can't solve everything. Now, we want there to be a comprehensive plan that will go along with better nutrition, if you're capable, have increased physical activity under the guidance of your physician, just to make sure that we are augmenting or adding to the benefit of the medication and not having the medication have to carry the full burden of, in this case, treating your high blood pressure. And then the very next thing I often tell people, just to make sure that we understand, is that you must take that medication. When you have high blood pressure, we're using medication to try and offset something that's not working optimally inside of your body. As Dr. O'Feely mentioned earlier, that could be because of genetics and the family history. It could be because of a lack of physical activity and overweight. It could be our diet, could be a combination of different things. But once you start the medication, we have to have you on that medication for a period of time. We want you to be able to monitor that. And then we want to monitor to make sure that we're achieving everything we anticipate that medication can do for you. Overall, the most important thing that can happen is that we get your blood pressure down into that lower range that Dr. Bond mentioned earlier. We want there to be optimal blood pressure because even low levels of high blood pressure, when I say low levels of high blood pressure, I mean, it doesn't have to be 180 all the time to really create a problem. It can be, the top number can be in the 140s for a long period of time and cause congestive heart failure and other complications. And then the very last thing I'll share with you, back to your other point, we often want people to be careful about the other lifestyle things they're doing when they're taking medication. We want you to consult with your pharmacist and other people if you intend to consume alcohol or other things. Now, one of the things that I have to really counsel a lot of people on, especially during football season coming up, is our energy drinks like Red Bull. They have very high caffeine contents, and continued use of that drink over a long period of time can offset the benefit of taking these blood pressure medications. And the common thing that's happened lately is to combine the energy drink along with an alcoholic beverage, and then to consume that for a long period of time during a football game. And this is just not an optimal thing, especially when you're on certain medications. So we want you to be cognizant, talk with your healthcare provider, talk with your pharmacist, and know the risk long before you get into those situations.
And Dr. Sneed, you said something so pivotal. Okay, talk to your pharmacist. I'm guilty of it. You get your prescription filled. Whoever's checking you out will say, do you have any questions for the pharmacist? Most people are going to say no, right? They'll say no. They'll go home. They'll read and they'll freak themselves out. And they're like, I'm not taking this. Or they're like, I'm going to call my doctor. And the doctors are busy. Like, I don't think they really have the time to. So would you suggest that they just slow down for that minute or 5 minutes and said, yes, I do, especially a new drug that they're taking, that, yes, I have questions. And what should they ask their pharmacists when they see them?
Yeah, that's a very critical question. I think one of the most important things you can do is talk to your pharmacist about potential drug interactions. Okay. Sometimes you may be going to 2, 3, or 4 or more physicians at one time. And sometimes there may not be a full understanding of all the other medications that another prescriber may have had. So number one, we want to make the pharmacist do a very fair assessment of what the potential drug interactions are. Now, even if a drug interaction may occur on paper, it doesn't mean it's going to be harmful for you. So we want to have a very good clinical assessment of that. But if we think there could be a dangerous problem, then we will communicate with your provider to see if there may be a safe alternative. Also, the most important thing I like to, again, talk to my patients about is warning them of what the most common potential side effects are, and then helping coach them through that problem. If we know a problem may come up, patients are less likely to discontinue a medication or avoid taking the medication from the very beginning if we counsel them from the very beginning on what to expect ahead of time and not have it become a problem after they started taking the medication. So I think having that conversation about the most common side effects that you can expect that may happen, or potential drug interactions, I think these are very critical conversations that your pharmacist will be very well equipped to handle.
Thank you very much, Dr. Sneed. That was so helpful. Oh my gosh. So next up, we have Mr. Broadwater. Now, we've talked about symptoms, things that we can look out for, but I think no one can tell you better than a person who has experienced it themselves. Welcome, Mr. Broadwater, to the show. I know that you are what we call a heart attack survivor. So you have survived what some people have not survived. So I just want to say thank you. Thank God for it. Can you please just give us briefly a little information about that day and how did it feel to have a heart attack?
Okay, so thank you to all the panelists first of all. But just imagine this, and I would ask that the audience, if they don't listen or hear anything else I say today, go get checked. Go get your blood pressure checked. You have to go in and get checked. So that particular day, I knew something was wrong, but I did not know what. A couple of things. I had this on active duty, so I was in shape. There was no way. And I think most of the folks that have a heart attack will say to themselves, "Oh, I'm not having a heart attack." I mean, I was on active duty. I ran a 14-minute 2-mile. I was in very good shape. Had stopped smoking a year prior and still had a heart attack. But I think one of the reasons why, because I didn't stop drinking. I still continue to drink the alcohol. And I say to those that are not doing health maintenance with their lives, please do that. But that particular day, started sweating profusely, as they say, knew something was wrong, just didn't feel right. By the time about approximately 10 minutes later, I got to the ER, the hospital. And from 10 minutes earlier to at the hospital, I started to feel the shortness of breath. And you hear the typical thing, you hear the typical phrase as it feels like an elephant on your chest. Well, I'm going to go a little deeper than that. Try to hold your breath. Take your clock out or watch out or stopwatch and try to hold your breath for 7 minutes. Just try to hold your breath for 7. That's what it feels like. Because after about 4 minutes, you want air. That's what it feels like. It is so, I mean, the pain, you can't really truly describe the pain. It is a tightness that you will never, ever forget. Never, ever forget. So I say to everyone in the audience, just like you take care of your car, you think about the air in your tires, you put gas in it. You've got to go see the doctor. Preventive health care is essential. Is essential. But to answer your question, Kitty, because y'all know I'm long-winded with that, but it felt a tremendous lack of oxygen. That's what I remember more than anything. And I was in shape. Went to the gym every day, ran every day. So when they talk about the silent killer,
yeah,
a myocardial infarction, that's the medical term of it. Quite simply, it is just a heart attack. And it almost felt like something is wrong. So I heard some of you say indigestion, go get checked. I don't care if it doesn't feel right, go get checked.
And I'm glad that you mentioned your prior lifestyle because, a lot of people would assume sometimes, oh, you have to be obese or you just had poor dietary habits, or maybe you were doing other things that caused it. So I'm glad that you did mention that. But briefly talk about, too, the survivor aspect of it. So now that you survived a heart attack, what is your lifestyle like now? What is your regimen as far as medications? Did you have to change the way you eat? Let us know.
Well, I take with me. I had what the cardiologists call a small heart attack. To me, there's no such thing as a small heart attack when you can't get air. But no stent. They did a cardiac cath. They said you can control this, Mr. Broadwater, by your medication. And I take a medication now that I probably have to take all my life. But it's okay. It's okay. Blood pressure is in the silent killer. It is the silent killer because you feel fine. You feel fine, but you're not fine. And I told the panelists the other day as we were talking, medication works when you take it. If you are suffering from hypertension, take your medication every single day. And I'll be honest with you, and some of the doctors on the call probably will get on me about this later. Men of my era, of my generation, we don't take the medication like we're supposed to. Every time I go to the doctor, I went to the doctor this week. The doctor asked me, Mr. Broadwood, you taking the medication? I said, I missed 2 days this week. And she let me have it. But I say to you, if you're on medication for hypertension, anything dealing with your heart, please continue to take it, because hypertension is the silent killer. You never know how you feel how you look on the inside. And one of those indicators is just your hypertension or just your blood pressure, which is critical. That's why they take that blood pressure every single time. I'm a former paramedic, flight paramedic. So, and I'll say this, Kitty, one of the worst patients that a doctor can have is somebody in the medical field. So I fit that bill, if you will.
All right, thank you, Doctor. I was going to say thank you, Dr. Broadwater, but you might as well say you earned it. All that knowledge you just gave us. I do have a question from the audience, so I'm going to go to Dr. Bond real quick. I know the show we talked about high blood pressure, but from Lewis Hines, is low blood pressure equally dangerous as high blood pressure? And what are some of the symptoms to low blood pressure?
Yeah, that's a wonderful question. So we really want to aim for that blood pressure in the normal range, which is less than 120/80, but there are situations where our blood pressure may be too low. So when blood pressure gets sometimes usually less than 90 on the top or even less than 60 on the bottom, you may feel signs of dizziness, lightheadedness, you may pass out. It's important to figure out what's the actual cause of that. Is it that the blood pressure medications that you're on are too strong for you? And this is where speaking to your clinician would be important. Is it because you have an infection that's driving that low blood pressure? There's a series of things that could be causing it. Is it because you're anemic or you're losing blood, as an example? So anytime you have blood pressure that's out of the norm for yourself, and this is the importance of checking it at home, I highly, highly recommend that you speak with your healthcare professional, especially if you're having symptoms for it or from it.
Well, thank you so much, Dr. Bond. All right, we got to pay some more bills. So commercial break real quick, and we'll be right back. And I'll be with Dr. O'Feely coming up next.
Journey. Vital Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Thank you and welcome back. So, Dr. O'Feely, I have a question for you. We've been talking all along about how it feels to have a heart attack, what it feels like to have high blood pressure and heart disease. But we have people that may say, I don't want any of that. So how can we prevent it? Can we prevent it through exercise? What should we be eating? What should we not be eating? I know you're going to ruin all of our plans today for probably lunch, but can you tell us how can we go on from this? How can we have a better diet, and what should we not be eating?
Well, so thanks again, Kitty. I think this is just a wonderful show. Lots and lots of engagement here. I really think at the end of the day, it is about balance. I think one of the areas we didn't talk about that we need to mention is sleep or lack thereof. So there is now a significant correlation or connection between poor sleep, either because you have sleep apnea, which means you're not getting enough air over a long period of time, or because you don't sleep enough, such as I'm guilty of that. But understanding what that does in terms of balancing your risk is important, and get checked out if you suspect you have sleep apnea, because that's an important thing that can be corrected and reduce your risk of heart disease. So you mentioned diet, exercise, what we do to control our weight in terms of, especially the one around the midsection. And I know you have all those commercials showing people try to remove fat from the midsection. We can do it urgently, but it is more important if we get to that goal by what happens with our physical activity. It is now pretty clear with lots and lots of research that if we walk just 30 minutes for 3 days or 5 days a week, if possible, but even not 3 days a week minimum, we reduce our blood pressure, we improve our overall cardiovascular health because the blood vessels are working better. And really, this gets me to the what Dr. Bond and others were talking about earlier in terms of knowing your own numbers, knowing how you respond to stress. Monitoring your blood pressure, your heart rate at different time points after you exercise, when you come back, and just owning your health, right? I told everyone I was going to have a shameless plug because we have a patent that came out of Morehouse School of Medicine. It's called Health 360X. It actually allows people to monitor themselves 24/7, not to create anxiety, but to allow you to communicate better with your doctor. Because whether you're on telehealth visit or in-person visit, if you came into your doctor and said, okay, I know I'm on these medicines, this is what my blood pressure ran at different time points over the last 3 months when I was at home by myself, this is what happened to my heart rate. And then one time I felt kind of funny, but it wasn't serious enough to go to the ER, but I checked my blood pressure and heart rate, and this is what it was. That is a wealth of information that cannot be replaced. If a doctor has that, whether it's by televisit or in person, they can actually help guide your care. So I want to leave one message for every single one of us. We no longer are at the stage where we just go sit in the office and say, just tell me what I need to do. Come in, own your health. Come in with some empowerment, because you do have that agency. And yes, we have in our process, we work with health coaches, and they are more culturally aware. So they're going to communicate with you based on some of the things you say and some that you don't say. I think that culturally congruency is important, to be culturally aligned, to understand when a patient says, oh, I didn't eat anything bad. But if that patient just had a can of green beans, and green beans should be good, but when it came out of the can, it has too much salt, and you won't share that because you don't think there's a problem with it. So these kinds of engagement with the dietitian, with people who understand how we eat, how we exercise or not, it's not a condemnation. It is really about surfacing it all, because you can still eat what you want to eat. Sometimes it's about balance as opposed to don't eat this or don't eat that.
Thank you. And it wasn't a shameless plug, because you do have a question from the audience. They want to know how can we access this device that you're speaking of? How can they get it?
You. Yes. Yes. They can go, you can go to health360x.com. That is health, like your health, and then the number 360 with X. And if you have your mobile phone, either on the Apple Store or Android, once you enter Health 360X mobile, you can get it and download it. And it's very important that you reach out to your physician to just understand how to use it. And again, we also have access to coaches. So just share some information on the website and we'll be able to help you. Thanks, Kitty.
Thank you. Dr. Sneed, we have a question, and I was hoping someone asked that question. So we're talking about medication, and I don't know if you can talk about it briefly or not, but we do have a question about lisinopril. I know that there's been a trending topic that it is not the best for African Americans. Also, too, I know I call him doctor, but he's not. But Mr. Broadwater mentioned when we were offline one time before he took his what was it, the vaccination, they asked him, did you take your high blood pressure medication, or are you on any medications? Can you give us quickly between lisinopril and the honesty that patients need to give caretakers about the medications that they're taking?
Yeah, this is one of the questions I get most often now in the public, especially from our communities. When it comes down to lisinopril or even that class of medications, technically we call them ACE inhibitors. For many decades now, we've tried to make the argument that maybe it doesn't work as well in African Americans because one of the proteins in the body that it really depends on has often been thought to be maybe potentially lower in African Americans. Overall, I think the thing I would tell you is, number one, very few people are going to depend on that class of medications as a single agent of medication to lower blood pressure. More often than not, people are going to be on a combination of medications along with that lisinopril. So it's not uncommon to have it in combination with, say, a water pill that can be added into the same pill. That's number one. Number two, very often for the medical conditions that we're going to use that medication for, it has been shown to be very effective in African Americans. We're not going to refrain or withhold that medication from African Americans simply because we term ourselves African Americans or people of color. Very often it can be very, very protective of kidneys and other conditions. And so if your physician has prescribed it, I encourage you to take it. But then it gets back to a comment that Dr. Ophelia was making. I want to make sure that all of us are understanding that we're just a few years away from the second quarter of the 21st century. And so technology, using our mobile phones as a healthcare tool to be able to give us information, collect information, track information, so you can provide that information back to your provider, I think is one of the most critical things we can do in communities of color moving forward. And so I would encourage you to go to her website or even talk to other people. It's something that she and I share. We talk about it pretty often. And we're trying to make sure that all African American persons have access to it. And then I think what was the third part, just very quickly?
I think that was the lisinopril and just the importance of being transparent, with anybody that, like, if you're going to get your shot or whatever, and someone said,
just very quickly. And this is a pearl on the nugget for everybody. Whether or not you're going, if you're going to see your provider, take your medication that morning. I can't tell you the number of people that walk in and say, well, I didn't take my medication before I came in to see you because, and I hear a myriad of, well, we want to know how that medication is working for you. So we want you to take that medication that morning so we can make a fair assessment. If you're going to, we want to know that you've taken your medication before you go get vaccinated. There's very few medications on the market, with the exception of possibly of some blood thinners, that we don't want you to take before you go get vaccinated or have other conditions. And so very often we're going to encourage people, please take that medication before you go see your provider or go into any other minor procedure.
Thank you very much. Dr. Bond, I think this question may be for you. It's coming from Betsy Jimenez. She said she has a thyroid issue. And does thyroid affect the heart and hypertension?
Yeah, that's a wonderful question. Many patients do tend to have several other conditions coupled to their medical health. And I will say that thyroid disease, either overactive thyroid, which is hyperthyroid disease, or underactive thyroid, which is hypothyroid disease, can absolutely affect the heart. It's something that we as cardiologists like to commonly check in blood work, because the blood work tends to tell us, is the thyroid actively working appropriately? When your thyroid is underactive, sometimes that could impact the pulse rate. It can make the heart rate very slow. It could also sometimes cause, depending on how severely low it is, fluid to build up around the actual lining of the heart or the heart muscle. And if the heart rate is, or if the thyroid is overactive, it could actually impact the heart rate by being too fast. By being too fast, that may make you more at risk of having a cardiac arrhythmia, which is an abnormality of the heart in terms of the fact that it's not in the normal preferred rhythm. So if you do have a thyroid condition, it's important that you do take your signs and symptoms very seriously, be it palpitations, which means that your heart is skipping a beat, or even be it if you're feeling shortness of breath as an example, and make sure you speak to your clinician because it definitely could be impacting the heart overall.
Thank you very much, Dr. Bond. And Dr. Brim, real quick for you, and if you can answer this as quickly as possible, we talked a lot about stress. Stress is the big thing. Men and women both have it. Do you have any suggestions for us that feel like we're just having a nervous breakdown? We're going to school, school's coming back in. I don't know how I'm gonna get my kids straight. I don't know how I'm gonna get here. And all of a sudden, ding, 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 the numbers are just going up. Can you give us some quick tips on how to de-stress?
Self-care is not selfish. It's important that we focus on mindfulness, especially as women, as parents, as fathers. We have to take that moment. We cannot help anyone else if we're not taking care of us. And also, if you're feeling overwhelmed, yes, we have awesome cardiologists on the line, but as someone who was in heart failure and cardiology and heart transplant, I always got patients that said, I wish I would have talked to my medical provider, i.e. primary care provider, before things got to that point. We're the gatekeepers. We work as a team. And I say communicate with your primary. Talk to them about what you're feeling emotionally. We are here to help you get to where you need to be so that we can help you to manage that high blood pressure, help you to reduce your risk of cardiovascular disease. So communication, I would say, and taking time for yourself, even if it's just sitting on a balcony having a cup of tea, or just talking with a friend. Those things help reduce things and hormones that are going on in our body that can increase the blood pressure, that can increase the fact that we're not getting enough rest at night, and they'll benefit you overall comprehensively.
Great. And I had one question and it came in, and I'm sure you can probably answer this. What's a good cholesterol level?
That is a great question.
Okay.
We want to look at things comprehensively, and there are different components of cholesterol. So total cholesterol, we would love for it to be below 200. LDL, that's the bad cholesterol. That's the one that can actually cause you to have a heart attack. We want that one to be below 100. However, if you have additional risk factors like diabetes, we want it to be below 70. But we're not just focusing on numbers. Everyone is an individual. So you need to speak with your medical provider, your cardiologist, about what are the target goals for you. We have tons of evidence-based practices and resources. We have tons of guidelines, but we have to tailor that to the individual. And you also have your good cholesterol, or HDL. And that one, you have to exercise. We want to get that number up of around 50 or better. There's no magic drug that can do everything for our cholesterol. So good nutrition, exercising, rest, limiting the alcohol, cakes and cookies, those type of things, they can increase the triglyceride levels, which increase your risk of having cardiovascular disease and heart attack. So those things are important in regards to managing your cholesterol.
Thank you so much. So while I still have the camera on you, I'm going to go around the room really, really quick because we're going into our closing. All right, I know it went by so fast. I mean, we need a part two. Definitely need a part two. So just really quick, any final words that you would like to tell everyone who's watching, anything about their health that you would like to say really quick in 30 seconds?
Communicate with your medical providers. Don't be ashamed to ask those questions. Come to your appointments with your list of questions, and because we want to consider the source. I have family members that say, Dr. Google said this. Love the fact that you're researching and wanting to become advocates for your own health, but we have to consider the source. And our clinicians, our cardiologists, our primary care providers, they can help you to understand what is fact and what is myth.
Thank you. All right, Marvin Broadwater, you're up next. 30 seconds. What would you like to tell us?
I don't know if I can do it in 30 seconds, Kitty, but I will try.
25.
Okay, look, 25. Okay, I can do it. I'll try. Look, to the audience, I plead with you, go get checked, period. In the military, I had 2 physicals a year. Now I have 4. Why? Because I pay for it. If you pay for health care, and some of it is even free, go get checked. Preventive health care is so important. And that's all. If you don't listen to anything any of the doctors say, just go get seen. That's all I have, Kitty. Thank you.
Thank you. Okay, Dr. Sneed, the time is running out.
Yeah, I think very quickly, I think I would encourage everyone to please know your numbers. If there's an opportunity to use technology to know your numbers, then we should do that. And also going back to the earlier topic before, I know that very often it can be a little bit upsetting to read about the potential side effects, but number one, the majority of those side effects probably are not going to affect you. The majority of those are happening in far less than 5% of people that take the medications. But then there's a parting word for all of you. We would like to encourage all of you, if you have an opportunity, to get involved in clinical research so that we can better understand the prevalence of side effects, especially in African American and Latino communities. So that we can understand better what may happen to you or what may not happen to you. And so, but know your numbers is probably the most important thing, and then use medication to help keep your numbers optimally so we don't have a problem down the road.
Thank you. Dr. O'Feely.
Yes. So, yes, I know. So we all have the power to influence what happens to us. We know we're born a certain way, but there are these social determinants in the environment that influence our risk. And the only way we understand how it's interacting with our body is to actually monitor ourselves and come into the doctor's office with empowered with some information. And then, as everybody has said, ask questions. And yes, join clinical research. Thank you.
Thank you. All right, Dr. Bond.
Yeah, I'll be very quick. So we know that heart disease is the leading threat for both men and women, but one thing we haven't addressed is that it's something we could prevent 80% of the time. So I can't echo enough the panelists about knowing your numbers, trusting your body, trusting your healthcare professional, and making sure you're doing everything in your power to prevent any bad outcomes. So thank you for the opportunity, and I look forward to doing this again.
Thank you. And you see, these doctors came all over the nation to give us some great information. I cannot stress enough, especially Palm Beach County. Come on, Palm Beach County. We need to get these numbers right. We have our communities that we need to make sure that we keep being engaged in our health. So just one quick shout out for Palm Beach County, but thank you everyone who has joined us. And if we didn't get to your questions, I do apologize. Obviously we have run out of time. I'm telling my producers and the powers that be, we need to do a round two. All right. All right. So I want to thank everyone for joining. Again, this has been a My Health Matters TV moment. Loved it. Thank you guys. Thank you, ladies and gentlemen. You've been wonderful.